Welcome back to Squawk. We asked you to tweet us your questions about the coronavirus. Now we have the doctor in the house. Scott Gottlieb is here to answer them. He's the former FDA commissioner, board member of Pfizer and Illumina, and a CNBC contributor. It's your highest ranking, I know. We want to start with this question. I keep hearing things about the limits of data collection, specifically the lack of enough testing kits. Have authorities already run up against that limit, or is that still in the future? What are we doing to grow testing capacity?
Well, in China, they seem to be limited. And if you notice, the reporting is pretty steady day to day, right? So it appears that in Wuhan, in that province, in the Hubei province, they can do about 6,000 tests a day on specimens. So that you end up sending 2 or 3 specimens per patient. So you figure they're running about 3,000 to 4,000 tests a day on patients. And so that's why you're probably seeing the 3,000 reporting. In the U.S., CDC forward-shipped 200 test kits to laboratories here in the United States. They're state and local health labs. Each kit can test 700 to 800 samples. Okay. You figure per patient, you might send in 2 or 3 samples. So we could test probably 50,000 cases now.
We got another question for you. This is coming from a viewer. China has reported coronavirus outbreaks for 2 weeks due to everyday numbers. Do you think that they have contained the virus, or too early to tell? Are there U.S. DC people on the ground in China to help them and get more information?
We don't have Americans on the ground yet as health officials. I mean, I'm sure we have people collecting intelligence. This doesn't appear to be contained in China. And now Singapore appears to have sustained community spread as well. So I think we're starting to see epidemic spread in other countries now, and we're just now beginning to detect that.
Okay, our third question. What is the likelihood of a pandemic of this illness here in the United States? People, including myself, are concerned that officials are not being completely truthful as not to hurt global markets.
Well, we're probably not at a pandemic yet. Pandemic means epidemic spread in more than 2 continents. We probably have some community transmission right now that we're not detecting. So certainly not thousands of cases, but there's probably dozens of cases right now.
Okay. Does it transmit only through water droplets, cough, sneeze, surfaces, things like that, or through the air? Much talk about negative pressure rooms.
Yeah, probably the way this is transmitting most efficiently is through touch. People touching surfaces or having dirty hands and then touching their face. It does transmit through aerosol, but you have to be pretty close to people to get aerosol transmission. So the best thing you could do is keep your hands clean.
Okay, we got another. Is it possible for the virus to be transmitted via goods shipped from China?
Unlikely. I mean, that's called fomites. It's unlikely to survive on a surface long enough. It's probably hours, not days, in terms of how it can survive.
And then the question that I heard over and over again this weekend, including from some doctors who said, you know what, the flu in the United States or in the world is terrible. How much more terrible is this?
Well, I don't think it's a good comparison. I mean, they're both bad. This could be worse. The case fatality rate for the flu is 0.1. This looks like it might be as high as 1%. It's probably going to settle between 0.2 and 0.5%. It does appear that between 5 and 10% of people who get this get a severe pneumonia. And the bigger concern here, or the biggest concern, is this looks highly contagious. And so the flu, what we call the R0, meaning the number of new cases for every case you have, is around 1.3. This might be as high as 4, but it looks like it's going to be somewhere between 2 or 3. So this could spread much more efficiently.
And do protease inhibitors work? Is there anything we can use that really minimizes the symptoms and stacks the deck in your favor that you're going to recover?
Right. I think we should be able to find an antiviral.
With something we already have, maybe, right?
We might have one already. The question is that if you introduce an antiviral in someone who already has severe disease, is it too late? Do you already have enough viral replication that simply interrupting further viral replication isn't going to provide a therapeutic benefit? And that's what we're going to figure out. Because after you have a lot of viral antigen, the inflammatory response is already taken over.
Do you think we'll know more in a few days because the 14-day incubation period is over for a lot of the original people?
I think we'll probably start turning over the card on outbreaks here in the U.S. towards the end of the month. Maybe in the next couple of weeks we'll start to detect it. Singapore has as many China travelers as the United States, and they clearly have sustained community transmission right now. So there's no reason to think that we didn't have introduction of cases here that went undetected.
Okay.